You're welcome to the Prosper in Health Association Health Enlightenment presentation. We titled this presentation, Men's Prostate Gland, a time bomb waiting to explode. We'll tell you what we mean by that in a moment. But let's just give you an introduction first. Now, the prostate gland is on the body of every male. It is of great importance for his health and well-being, especially his fertility and his sex life. But unfortunately, so many men, especially the educated ones, know little or nothing about it. So, what is there to know about it? First of all, it's an issue that involves the woman too. Yes, it's a challenge of the man, but when the problems come, it is the women that bear the brunt of it. So, women, please listen attentively. So, what do you need to know about the prostate gland? Firstly, what exactly is the prostate gland and where is it in the male's body? Then, what can go wrong with it and why? Then thirdly, how can you prevent this from happening? Finally, how can you manage or resolve it if and when it is malfunctioning? These are very, very pertinent issues that need to be trashed. Now we take it on one by one. Now, what exactly is a prostate gland? That's it right there, right under the bladder. You can see it right there. A tube comes in from the bladder, goes right through the prostate, and comes right down through the tip of the penis. Now, another tube comes from the testes, goes right through the prostate gland and joins with the tube coming from the bladder. And both of them drain as one tube right through the male penis. That's exactly what the prostate is. It's a gland. And what's a gland? A gland is an organ that manufactures and secretes fluids. Like I said earlier, it's found only in men. And contrary to popular opinion, the prostate is your male sex organ, not your penis. At birth, it weighs about 1 gram, grows to about 20 grams when a man reaches puberty, and thereafter grows rapidly. For some men, it increases up to 5 times its normal size. Now, what exactly is it for? It's there to manufacture 1/3 of the volume that we know as semen. Then it's also responsible for mixing that semen with fluids it receives from other neighboring glands, and is responsible for forcefully expelling the semen right from the tip of a man's penis. It's also responsible for expelling urine too. So you see how important this small but very sensitive organ is. It regulates the flow of urine and semen because they both go through the same tube, the urethra. Then it's responsible for the production of a very, very important fluid for fertility. It's known as prostate-specific antigen, PSA, and the prostate gland is directly or indirectly responsible for penile erection. Why? Because 2 nerves, known as the erector nerves, are on either side of the prostate gland. So, where is the prostate gland? Well, from its name, you have an idea of its position. It's from the root Greek word called prostatis, which literally means one who stands before. And that's exactly where it is located. If you view from the tip of the penis, it stands before the bladder. Now, like I said earlier, there's a tube coming down right from the bladder, passes right through the prostate gland and drains through the tip of the penis. Then the other one comes from the testes, joins with the one coming from the bladder, and both drain as one. Now, because that urethra passes through the prostate gland, that exactly is the root cause of the challenges of the prostate gland. Why? Because when the prostate gland starts enlarging, it piles pressure on that tube. You can see from this diagram, there's a constriction that happens when the prostate gland enlarges, and that narrows the urethra and, of course, compromises all the functions of the prostate gland. Now, the next question is, what happens? Why does it get enlarged? Well, I'm sorry to disappoint you. Medical science have not been able to adduce a reason for the enlargement of the prostate gland. However, they have noticed a coincidence that happens when a man attains the age of 40 and the enlargement of his prostate gland. Scientists have found out that when a man reaches 40, he goes through a period of hormonal changes. These hormonal changes affect two hormones. One is called testosterone, that's the main male hormone, and the other is called estrogen. That one is more commonly found in women. Now, testosterone drops by as much as 50%, and estrogen rises by as much as 50%. The change in the hormonal balances of these two hormones have been attributed to the aging of man when he reaches 40 and above. And scientists have found out that a coincidence takes place when these hormonal changes happen and the enlargement of his prostate gland. So they have suggested that it may be directly or indirectly responsible for the enlargement of his prostate gland. That exactly is what medical science says about it. Well, that's why we call it the time bomb, because as a man ages, it's like the clock is ticking. What are you going to do with your own? Would you allow your own prostate gland to explode? It will not be advisable for you to allow that. You can see from this chart here, as a man attains 40 years of age, the likelihood of prostate disorders increase, such that when he reaches 50, there's a 50% chance of him developing prostate challenges. And when he reaches 70 years of age, the chances increase to 70%. Now let's come back to that hormonal change that we talked about earlier. It's actually known as andropause. Exactly what I called it, andropause. That's the male equivalent of menopause in women. I'm sure a lot of men don't know this, that we too, just like women, experience hormonal changes. Theirs is called menopause, ours is called andropause. And you can see from that chart, as a man reaches 40 and above, the testosterone level drops with age, and that happens with the enlargement process of his prostate gland. Unfortunately, some other things happen also when andropause sets in. As you can see from that diagram, the staff of office loses its functioning, if you understand what I mean by that. So, what are the disorders of the prostate? Basically, there are three main challenges of the prostate. We just run through them. The first one is called prostatitis. That's an infection that causes an inflammation of the prostate gland. The second one is known as benign prostatic hyperplasia. That word benign means non-cancerous. Hyperplasia means rapid and multiplication of cells that causes an enlargement of an organ. So it's a non-cancerous enlargement process of the prostate gland. The third one is when prostate cells start growing abnormally, multiplied growth of abnormal prostate glands, prostate cells. I don't want you to wait until you have any of this. So listen carefully and be proactive to avoid them. So let's take the first one, prostatitis, an inflammation of the prostate gland traced to bacterial infection, although there are some other causes of that infection. Now, if it is not well managed, these infection can lead to what is known in medicine as chronic pelvic pain syndrome. Now, you don't want to have that. It comes with severe lower back pain and pain in the pelvic region. And that can be very excruciating in some cases. It's usually common with men from the age of 25 to up to 40 years of age. Now, when the prostate gland gets inflamed, it leads to infection of the bladder and so many other associated problems. You see there the symptoms: pain and discomfort in the pelvic area, peppery and burning sensation during urination, then irregular urination. You feel like urinating every now and again. Then urgency to urinate. It's like you just have to get to the toilet. Well, the next one, benign prostatic hyperplasia, BPH. That's an inflammation of the prostate gland. You can see a normal prostate gland on the left there. You can see the enlarged prostate gland that has constricted the urethra, the passageway of urine. Well, what are the symptoms? Voiding problems, the release of urine. The urine streams gets weak. You find out that the urine stream splits into 2 or 3 streams. You find out that you start having hesitancy problems. You get to the toilet, you urinate. Urine doesn't come out 2, 3, 4, 5 minutes while you're in the toilet. Then you have what is known as terminal dribbling, where you finish urinating quite all right, but guess what? Urine is still dripping. Then we have what we call the incomplete emptying. After urination, you still have urine left over inside the bladder. Why? Because it's trapped in it, because it cannot leave your system. Now, when urine stays in the bladder, it leads to bladder problems. First of all, the bladder muscles get expanded and they cannot hold on to urine anymore. Then infections set into the bladder and the complications that come with it. So the next problem is the prostate cancer. This is when the cells of the prostate get cancerous. And you can see there from that statistic, prostate cancer takes as much as 40.67% of cancer sites in men. It's known as the #1 killer cancer for Nigerian men. I won't advise you to be part of the statistics. Now, who are the people that are most vulnerable to prostate cancer? The first group of people are men over 40, especially those over 50. Also, men who consume a lot of alcohol, men who don't get enough exercise, especially men who have a history, a family history of prostate cancer. You have your father, your uncle, your brother who has or has died from prostate diseases. You need to be very watchful with yours. Then we have those that have very poor diet high in fat, diet full of red meat, diet with low vegetable intake. These are the set of people that are most vulnerable to develop prostate cancer. Well, what are the problems of the prostate gland? We're telling you so that you can avoid it. And if you have it, we have solutions to help you resolve them. Well, they split into 2 main classifications, which we call the bedroom problems, and the second one, the bathroom problems. We take the bathroom problems first. Well, we've mentioned it earlier: sudden urgency to urinate, weak and interrupted urine streams. It comes out in spots. For some, comes with a lot of pain. Then we have this full bladder feeling even after you finish urinating. Then for most, they have a lot of urination overnight. If you wake up 2, 3, 4, 5, 6, 7 times before day breaks to urinate, please, we need to talk, and we need to talk now. Then we have leakages, where the bladder cannot hold urine anymore and it starts leaking, and such men are forced to wear diapers. You can see there, yes, men wear diapers now. They can't control urination and they don't have to soil their pants. Do you notice any changes in your urination patterns? You need to be very careful now, especially if you're near or over 40 years old. How about the alarming bathroom challenges? Bloody urine, where blood mixes with urine, or in worst case scenario, where blood mixes with semen. It's called hematospermia. Then we have urine retention in the bladder. When urine cannot be discharged through the urethra, it stays in the bladder, leading to severe infections, leading to bladder stones, leading to kidney damage. Then we have the worst case scenario, where the bladder gets blocked. And that's when men have to go for operation to start using the apparatus called the catheter. You don't need to wait till that. Look at the situation where we have bladder stones blocking the passageway of urine in the urethra. You don't need to wait till you experience all of that. Don't wait till problems happen. Now let's look at the bedroom challenges. We jokingly say they're missing in action in the other room. Well, what are the symptoms of that? The first one, and very embarrassing one, is pain or discomfort during sexual acts. Why? Because that is the same passageway of semen. So you find out that men that are having challenges with their prostate have challenge with sex also, especially when they reach orgasm. Then we have low sex drive. Look at the wicked look on the face of that woman. She doesn't understand what is going on with her man. the sex drive is just not there. And it also affects their sexual capability. The man just cannot perform in bed. Romance is totally out of it. Then we have a situation where the staff of office goes out of action. Absolutely no network, if you know what I mean. Are you having a challenge in your sex life? Well, let's talk and let's help you solve that problem. Then the next set of problem in the in the bedroom is that as a result of the lowered level of testosterone, where we have penile erection weakness as a man ages. We have a situation where the penis size is shrinking. That's as a result of testosterone reduction in the system. Then we have situations where the sexual stamina, the sex drive is just not there. I call such men the 1 minute no-do. Then we have a situation where a man starts growing breasts beyond the average size of the breast of a man. Then we have mood swings, emotional disorders, even depression. For some men, even suicidal tendencies. These are all the challenges of low testosterone, popularly called low T. If this is your challenge, we need to talk. Well, we've come to the end of the presentation today. My question to you now is, are you experiencing any of these symptoms? Has any of the things that I've spoken today resonated within you? If so, please let us talk. But even if you're not experiencing any of these challenges, would you rather wait till you start experiencing them? Is it wise for you to wait until you are having discomfort during sex, or blood is mixing with your semen, or blood is coming out with your urine? Is that when you want to take care of your prostate gland? Would you rather wait until your breasts start growing to the size of women's breasts before you know that you are having problem with your testosterone level? If a man will not wait until the car starts overheating before he maintains the cooling system, why then wait until your prostate malfunctions before you take care of it? Today, we talk to you about preventive healthcare. They say that prevention is better than cure. Well, I believe it's a lot more than that. Prevention is not just better, it is cheaper and safer than cure. I'll close my presentation with an admonition to you today. Protect your vital equipment. You see, for most organs in the body, you can replace them. But for this vital equipment of yours, you can't replace them. Please take care of your vital equipment. Having listened to us today, we close with this last slide. We have solution for you. If you are challenged with your prostate gland, or you don't want to experience challenge with your prostate gland, we are here to help you. You have an option of clicking the link, and that sends a direct WhatsApp message to us. Just click on the link below and you will be able to communicate with us directly. Or just drop your phone number and we will get in touch with you. Thank you very much for your time to listen to this presentation. God bless you and have a healthy prostate. Bye-bye.